Starting in the new year, the University of Washington is sending some of its nursing students to work at long-term care facilities.
The new program is state-funded. The hope is to start addressing a major staffing crisis in the field. Fox 13 News reporter Jennifer Lee shows us the different partnerships that are now coming together.
I used to help make video games.
Michael Drake left his job in tech to join the front lines of healthcare.
I had a family member, my mother, who had terminal brain cancer. And so I quit my job to be an end-of-life caregiver for her. And then after she passed, I decided I wanted to continue to be a nurse.
He's now chasing his goals at UW School of Nursing. In January, Drake will be one of the first students in a new 6-month externship program that provides hands-on experience at long-term care facilities.
When I saw this opportunity, I leapt at it because it just gives me more of a chance to work with other nurses and to learn from them before I become a nurse myself.
The Washington State Healthcare Authority says there are critical shortages in long-term care made worse for several reasons, including lower wages, COVID demands, compassion fatigue, aging workforce, and higher paying opportunities. Kristen Bolos of Empress Healthcare says she's looking forward to the partnerships with students.
We're going to pair up with them. They're going to come and they're going to have a mentor within our centers and really just learn what our culture is and what long-term care is. And these are the folks that are particularly interested in long-term care.
Mindy Schaffner is facilitating the program at Pennant Healthcare and says one of its goals is providing dignified long-term care.
How better to do that than to connect with an academic institution that has evidence-based practices and research and really can help foster that quality of care that we so want to provide in our facilities.
The program is funded by a state grant that's worth $167,000. A state spokesperson with the Department of Social and Health Services says, quote, their knowledge and skills can be used to make a significant difference in the lives of older adults who have physical or cognitive disabilities, and to demonstrate that a specialty in geriatrics opens up many career opportunities.
I get to see how nurses teach other nurses, so that when I do that, I can do it well and hopefully bring up the next generation of nurses.
In Seattle, Jennifer Lee, Fox 13 News.
A spokesperson says the number of people 65 and older in the state is expected to double over the next 2 decades, and many will need long-term services and supports. Officials with UW say the plan is to eventually expand the program to other universities and facilities around the state.